This is Dr. David Pham at Arbo Dental Care. I'm here with a public service announcement because we've got another fractured molar. I couldn't believe it. Patient walked in the other day on emergency. They said they broke their tooth. And most of the time it's just a small chip that can be repaired, but this patient has a history of breaking teeth, and the question was which one. We tested out the teeth. We took a look. They have a history of clenching their teeth pretty hard, but also eating hard foods. And the first thing that we saw and we decided to do was that we needed to treat some teeth in this area. And we initially started with some freezing after initial testing. We froze the patient because the treatment's going to happen. Either was going to remove the tooth or we're going to try to save it. The question was, is it savable? The first thing that we saw that made it clear that this tooth was not savable was this fracture line. It looks small, but when we look at it and look to where it extends to, which goes across this part of the tooth and goes all the way across here, normally when a tooth fractures, it does not include this part of the tooth. Very, very rare. But when it does, this is not part of the tooth. This is not normal tooth anatomy either. This told me that this was a deep fracture. And as we took a look and we started to move the fragment around, we could see that the blood started to fill in the cracks and show the extent of the fracture. And I could even see that there is an infection that's starting back here. Let's take a look at the video. This is the full extent of the fracture. We were slowly removing it. I was filming with my left hand, so I couldn't take out the fragment and film it at the same time. But here we go. And finally, after the tooth was removed, this is what it looked like. And what ended up happening was that this is actually the nerve of the tooth, and the gum was bleeding, so it was filling it up, but there's no nerve left in there. We tested it beforehand, there was no response. The fracture had cut through the nerve, the bacteria infected the whole tooth, and now the whole area is infected. We had to take the tooth out. It was no longer savable. And there are definitely ways that we could have, that this patient could have prevented it. One is that we would like to see them regularly for checkups, so we can talk about preventive measures. That would include a mouth guard or a night guard to protect the teeth at night. Second, bringing their awareness to that they're clenching and grinding at night. So during our history, we discussed the clenching and the grinding during the day, and most likely when you're doing it during the day, you're likely doing it at night as well. Third, hard foods. They tend to chew a lot of harder foods. And with their clenching and grinding, they're working their jaw muscles a lot more, which makes their jaw muscles stronger and makes it more likely for it to become an issue when they are eating certain foods. When they bite down hard enough, it starts to actually crack the teeth. And when there's hard food involved, it actually puts uneven pressure on a tooth, and that leads to it fracturing, like we see in the video. Hopefully this gives you a lot of insight, a lot of information on how to avoid these fractures. And make sure you see your dentist regularly, whoever they are. Get your x-rays checked just to make sure. And so we can avoid these painful consequences, but also just to make sure that there aren't infections starting as well. In this video, you could even see that there's something starting with the tooth at the bottom of the screen here. There's a cavity, but also another crack forming. That's for another day. Get your teeth checked. Make sure that you don't have any other issues. Follow the preventative treatment, because when you are preventing when you're preventing a problem well, you will not even get a chance to see what the problem is like. Thanks for listening. Thanks for watching.